The evolution of LASIK is really a very interesting story. I think a lot of eye care started in 1949 when that was the year contact lenses were invented. That was the year the first cataract implant was put in a patient's eye. And that was the first year that the pre-runner of LASIK was done. Going back to 1949, you had a Dr. Jose Barraquer, who comes from a very famous family of eye surgeons in Spain. The whole field of LASIK came out of his head. The first case he did was manually making what we call it wasn't a flap then. He removed the surface of the cornea from a patient. And remember, contact lenses were invented that year. He already had, in another part of town, a cryo lathe. They were a lathe used to put the prescription in plastic for contact lenses, but it was also, you could freeze things with it. So he traveled across town with the patient's surface of their cornea, froze it on the cryo lathe, etched the prescription in it, and drove back and sutured it back on the patient's eye and cured their nearsightedness. That was the first case, 1949. It was all free-handed. Now, of course, we use lasers for everything. So, Barraquer worked on this tirelessly forever, through the 1950s, through the 1960s, inventing instruments to make it easier so we wouldn't have to freehand things. And then came along a brilliant student in the early 80s, Luis Ruiz, who the other students in the residency program resented because he was made the chief resident when he was a first-year resident, which never happens. It was bizarre. But Barraquer recognized something in Ruiz. And Barraquer brought Ruiz under his arm and brought him into his lab, and Ruiz became his research assistant as well as the chief resident. And Ruiz was just brilliant, although Ruiz says he's really never met a genius other than Barraquer. And Barraquer was coming up with mathematical formulas and all things on how to change the shape of the cornea. And he'd done it before anybody would even ever think about it. Ruiz comes along and learning so much from Dr. Barraquer with an instrument that he created with gears that would move across the cornea, but you'd still have to move it with your hand at a set rate and a set pressure, and it was very dependent on the surgeon's skill, and they were removing the surface of the cornea and still freezing it and etching a prescription in it. Ruiz came up with the idea, say, well, why don't we just forget about changing the prescription in the surface of the cornea that we're removing with this instrument. Let's just take that, move it aside, and then take a similar instrument to change the shape of the underlying cornea, and then put this cap back over it for quick healing. And that was a change in the mindset of the whole way of viewing it. And he said, not only that, let's try to automate the instrument. There was only maybe 10 people in the world who were doing it, and then now they have to work on it for 30 years already. And so he said, let's automate it, and that's what he did. So we go at the same speed on every case and the same pressure on every case, and so it would be more of a consistent result. And that was called ALK, automated lamellar keratoplasty, invented by Dr. Ruiz. As a result of that, Dr. Ruiz was kicked out of the Barraquer Center because Dr. Ruiz got a patent on it, and it upset Dr. Barraquer. Ruiz set up his own center. And then he started presenting it to the world, and it became easier for surgeons to do because his instrument was automated, and it was more duplicatable. But there were questions about this procedure, and I really wasn't that interested in doing it. There were some complications. A doctor in Greece understood what Ruiz was doing, and there were doctors in Columbia University in New York, ophthalmologists PhDs in the laser field, learned about a laser that IBM was using to etch computer chips, and had certain properties that they thought could be used to change the shape of the cornea without hurting the cornea. And so they jumped on that and started doing research on that, and it really worked. They were doing it on the surface of the cornea, a technique we call today photorefractive keratectomy, or PRK, not to be confused with RK, the old technique. But the doctor in Greece took Ruiz's idea with his instrument to create this, now we call a flap, to move that surface of the cornea aside, and then to use this laser they were using at Columbia University to change the underlying shape of the cornea, to correct nearsightedness or farsightedness or astigmatism, and put the flap back for quick healing and quick recovery. And he named it laser-assisted in situ keratomileusis, what we call LASIK, the doctor in Greece. Ruiz had recognized that, wow, that's better than what I'm doing, so he jumped on that early. I had met Dr. Ruiz, and we became friends. And he would come into Richmond, and he would start giving me little slide presentations on, hey, you know, why don't you do ALK? You know, I said, well, I don't know, there's some questions I have about it, you know, and I said, well, what do you think about it? Well, he says, I'm not doing ALK. They're teaching all these courses, and all these surgeons are learning it, you know, and I said, well, what do you do? I'm doing some procedure called LASIK. He said, let me teach you about LASIK. So he starts teaching me about LASIK. I said, you know, that sounds good. I'm interested in that. He says, come on, I'll do ALK with you. I'll be here, I'll come into Richmond, I'll be there with your surgeons. I said, no, I don't want to do that. I want to do what you're doing. That seems much better, more accurate and safer for the patients. So he said, all right, well, why don't you come down to Bogota? You bring your patients. He says, you can't do any of my patients, bring your own patients, and I'll teach you. You know, I'll do one eye, and you can do the other eye. I'll be right with you, and I'll train you. So, and he had never allowed any, you know, he had a world-famous surgery center, and he had no American surgeon had ever operated his center. And he took me on, and I was flying patients to Bogota, and he would do the dominant eye, and I would do the non-dominant eye, and it was kind of an adventure. We'd go down with a few patients, fly down to Bogota, which is kind of a scary place, do the surgery and come back, and the results were amazing. It was miraculous how well they were seeing. So I just wanted to learn more and more. I kept going. At the same time, some patients were a little afraid to go down there, I had heard about an island in the Caribbean where we could possibly set up a center. And so I thought it would be a great way to, you know, you're training me, why don't we train them the same way? You know, you can be with them during surgery, and they could come and to this, to Turks and Caicos Islands, which is part of the British system, and we'll train them. And so he said, that's a good idea, why don't we do that? And so, but it fell on my lap. I had to organize this whole thing and set it up. It was very expensive, time-consuming, and frustrating dealing with the government and all that, and setting up in the middle of nowhere a laser center, but we did that. I would go down, and patients heard about it, so patients were coming in from all around the United States, Canada, and I was, some of them, of course, were my own patients. Some doctors were bringing their own patients to train with Dr. Ruiz, and some were just flying down that I was examining before surgery day and setting up for surgery and, you know, operating on along. Again, I continued my training with Dr. Ruiz. Another interesting adventure, wasn't easy, but it was a lot of fun, and LASIK was so far superior, very safe and very accurate, and really wonderful technique that was developed with this very interesting history that patients could benefit from today.